Welcome to our CFP exam prep discussion focusing on the Patient Protection and Affordable Care Act, commonly known as PPACA or ACA. Today, we're diving deep into essential requirements and mandates that frequently appear on the CFP exam. Let's start with the core concept of essential health benefits. The PPACA requires insurance plans to cover 10 fundamental categories of health services. These include hospitalization, emergency services, prescription drugs, preventive care, maternity care, mental health services, laboratory services, pediatric care, including dental and vision, outpatient care, and rehabilitative services. A common mistake test takers make is confusing preventive care with rehabilitative services. Remember that preventive care is about preventing illness, while rehabilitative services help recover from medical conditions. Moving on to lifetime limits, the PPACA strictly prohibits insurance companies from imposing lifetime dollar limits on essential health benefits. This is a significant change from pre-ACA practices. Test questions often try to trick candidates by mentioning annual limits on non-essential benefits, which are still allowed. Keep in mind that while lifetime limits are completely banned, some annual limits may still exist for non-essential services. The metal tier system is another crucial concept you need to master. The PPACA established 4 main categories: bronze, silver, gold, and platinum. Here's where many test takers get confused. The metal tiers don't indicate the quality of care, but rather the cost-sharing structure. Bronze plans typically cover 60% of healthcare costs, silver 70%, gold 80%, and platinum 90%. A frequent exam trap involves questions about out-of-pocket costs. Remember that bronze plans have the lowest premiums but highest out-of-pocket costs, while platinum plans have the highest premiums but lowest out-of-pocket expenses. Understanding the silver plan's special role is particularly important. Only silver plans offer cost-sharing reductions for eligible low-income individuals. This is often tested on the exam. Many candidates mistakenly assume all metal tiers offer these reductions, but they're exclusive to silver plans. The PPACA also implemented the individual mandate, requiring most Americans to maintain qualifying health coverage or pay a penalty. However, be careful here. Since 2019, the federal penalty has been reduced to $0, but some states still maintain their own individual mandates with penalties. This detail often appears in exam questions trying to test your current knowledge of the law. Let's look at a practical example that might appear on the exam. Consider a client who asks about switching from a bronze to a silver plan during non-open enrollment periods. The correct response would involve checking if they qualify for a special enrollment period, as changes typically can only be made during open enrollment or after qualifying life events. Another critical aspect is the employer mandate. Companies with 50 or more full-time equivalent employees must offer affordable coverage meeting minimum value standards. The exam often includes questions about calculating full-time equivalent employees or determining if coverage meets affordability requirements. Remember these key points about the PPACA. All essential health benefits must be covered without lifetime limits. The metal tier system reflects cost sharing, not quality of care. Silver plans uniquely offer cost-sharing reductions, and while the federal individual mandate penalty is $0, some states maintain their own penalties. Understanding these concepts and their practical applications will help you navigate PPACA-related questions on the CFP exam successfully.